Cancer. I want you to think about cancer in a way of a cell. Okay? Every body has a cell inside their body. And I want you to think of cells like structural material. If that cell gets impacted with waste, it becomes inflamed. And then it develops to be a cyst or a tumor. And then that tumor can or cannot be cancerous. Malignant tumors are the leading cause of death of cancer. So, whatever you eat is structurally what your body is made of. Cells make tissue, tissue make organs, and organs make organ systems. So when a cell eats hot fries, Coca-Cola, any kind of a Little Debbie or whatever, that cell then has to structure the tissue of your body. So the tissue of your body would be your lungs, your heart, your liver, your stomach, your spleen. What I'm trying to say to you is whatever you feed your cells is equivalent to the quality of the cells that actually have to build your organs. So we have a high incidence of cancer, and we have been perplexed because there have been, like they say, is there a cure? Is there not a cure? Everyone is different. Think about the environmental things that can give you cancers, the toxins that you ingest. Remember, if you ingested a carbon monoxide, or if you outside, or if you're in the, what's that thing called downtown, the underground, those are toxins. So you breathed in a toxin, so that cell ate the toxin. So that cell's job is to make a tissue. So now that tissue is toxic because of the cell that it was built from. So that tissue becomes an organ. So that liver now is a toxic liver because of the cells that ingested the actual toxins to make the tissue, to make the organ. Please let me know if you're not following me. And your organs make organ systems. So this thing didn't happen overnight. So when people have prostate cancer, liver cancer, blood cancer, we're talking about the cells of the body that took in the toxin. That cell has to make the tissue of the blood. It has to make the tissue of every part of your body, and the tissue makes the organ, and then the organ makes the system. So what am I saying? We have to make sure that we clean our cells. We have to make sure that the food that we ingest inside of our body cleans our cells as much as possible. We have to play self-defense, because not only are we having foods that don't have good nutrition because of the soil that it was grown in, because they robbed that. Not only are we dealing with, we don't know where our foods are coming from. You could have a label on it. If you eat meat, they could be putting dyes and stuff in it. It could be rotten meat. These things become toxic inside the body. So next, if you want to be proactive, because we all have cancer cells inside of our body, what determines whether or not it becomes an issue, okay, before it becomes a syndrome of disease, is how much toxins has that body actually ingested and how much of those toxins were able to actually come out, which makes you think of ingesting smoke and ingesting poor foods, being stressed, environmental stress, the lead inside the water. There's so many things that we have to deal with that makes the cell inside the body sick. But no matter whether that cell is sick or strong, its job is to make tissue. And so it says, look, I'm going to make some tissue, but I'm sick. So that means that the tissue is going to be sick. And the tissue is like, well, it's my job to make an organ. So that means that organ's going to be sick. And that organ said, wait a minute, I'm a part of a system. So that means the system is going to be sick. The reproductive system, the respiratory system, the digestive system, the excretory system. You didn't get sick overnight. Cancer didn't come overnight. This is an accumulation of bad building materials. A lot of times, our body is very resilient. So trust and believe. When you were a child, the things that you did as a child, you were still building materials. So you got to go through the analogs of your mind and say, throughout my life, how much good stuff has gone through my body? How many times have I tried to cleanse my blood? How many times have I tried to cleanse my system? You can't just do it once, because we're constantly being exposed to toxic things, toxic foods. We're constantly being exposed to that. So garlic helps the immune function. You can take 2 capsules 3 times a day or cook with it. Selenium, 200 milligrams a day. Helps the body rid itself of impurities. We have to make this a part of our life. Dr. Africa made a supplement called Blood Purifier. It has a conglomeration of all these things in it, but I'm giving you an example. MSM, 1,000 milligrams to 2,000 milligrams a day. It combats any disease inside the body. MSM, okay? Methyl sulfate methane, that's what that's called. MSM helps the body to combat disease. So inside your cabinet, you should have your arsenal of healthy stuff. Just like in your refrigerator, you have an arsenal of food when it's time to eat. Calcium stabilizes healthy tissue. 2,000 milligrams a day. But remember, what did I say about all minerals? If you're going to take calcium, you make sure that you take a multivitamin mineral before you try to take any of these singular. Vitamin C plus bioflavonoids, 5,000 to 10,000 milligrams a day, combats cancer. Vitamin C plus bioflavonoids, 5,000 milligrams to 10,000 milligrams a day. What do you have to take with this? A multivitamin and mineral. Herbs, you got burdock, chaparral, dandelion root, golden seal. These are powerhouses to help keep the blood clean and keep the cells clean. Good foods that you can eat: blackberries, broccoli, collard greens, mustard greens. There's so many more. If you have the textbook of African Holistic Health and health dictionaries, you will see that. So I want to empower you to know that every day that you get up is a healthy day, and that you have to have a healthy behavior. You can't just do it once and think it's going to last you a lifetime. You can't just start healing yourself. You can't just say, you know what, I'm going to take this for a week, and then you go back to bad behavior and saying, well, that good thing didn't work. Because you got to let it stay in the bloodstream. There's something called a half-life. When you're taking a pharmaceutical drug, they'll tell you, if it's a blood pressure med, a diabetic med, they say, I want you to take this 1 time a day, because they know that that drug will be active inside the bloodstream for 24 hours. And it will lose its effectiveness if you don't take that next one within 24 hours. Herbs are the same way. Supplementation are the same way. They have a level of effectiveness when you put them in the bloodstream. And if you're going to take it, if it says once a day, then take it once a day. But if it says take it twice a day, then you take it twice a day. The time it tells you to, don't skip any, because you don't start healing the body until it stays inside the bloodstream. That's where we go wrong. We don't have a concept of understanding. It might take you a year of this stuff being in your system to clean the cells to make the tissue healthier. So, if you can understand that you have to be kind to yourself and be patient and just know you've been tripping for a whole long time and that it might take a little while for your body to start to snatch back, it will be okay. Just stay consistent. What most health practitioners say, it's not what I'm telling you. It's called patient compliance. Are you going to do what it needs to be done to be healthy? And lastly, we are going to cover